today I'm going to be spilling the tea in my hot coffee cool mom cup on everything that no one told me would happen to my body after giving birth. 4 to 6 weeks after delivery, you'll have your first postpartum checkup. Now, at this checkup, your doctor will decide if you need to come back in for routine checkups or if you're good. For me, I had my postpartum checkup at 4 weeks because I tore and needed stitches. I believe for most persons, if they've had a C-section, then they are more likely gonna be asked to have that 4 weeks checkup. For persons with regular vaginal delivery, it's usually at that 6 weeks mark. However, I guess because of my tearing, I had to go to my doctor before that. So at that point, he checked me. He said, okay, you're healing well. You have not completely healed. Come back in about 3 weeks. Now, in 3 weeks, we went back to the doctor. I don't know why I said we. I went back to the doctor, and he said, okay, you've completely healed. We need to do your pap. So we did a pap. So a pap smear is also called a pap test. So this is just to examine the cervix and to take a sample or a swab sample, I guess you can say, of the cervix to ensure everything is good, there's no sign of precancer cells, etc. So in this procedure, you're going to get onto the gynecological chair. In that position, spread your legs open. The doctor is going to insert the vaginal speculum, lubed of course, and then you're going to take a swab and just do a swabbing of the cervix. This procedure takes, I don't know, 5 minutes. It's really simple, really 1, 2, 3, get done, and you're done. You're all out of there. Before the pap, there is no douching. I believe there is no sexual intercourse for at least 2 days. No creams, spermicides, etc. Now, if all goes well, then great. If all went well, then I wouldn't be making this video now, would I? So at this point, for me, I believe it was a few days to maybe a week or two, my doctor called and he said, your pap came back irregular and we want to see what's going on, so we're going to do a biopsy. Now, obviously you associate biopsy with, I guess, more critical and serious issues, so my mind went there. He said not to worry, right now it doesn't necessarily mean you have cancer. It doesn't mean any of those things really. You just had a baby, so it could be, hormones are still messed up, etc. So we went ahead and scheduled that biopsy. Now with the biopsy, the same rules apply. No sexual intercourse, I think, for 3 days, no spermicides, and you need to schedule this when you're not on your period. So it's a very similar procedure. You get on the chair in a gynecological position. Again, the speculum is inserted, lubed, but this time around, it is not a swab. It is a actual tissue sample. So it's like a snipped tissue sample. I believe they call it a pinched or pincer sample. So this one is actually, I really don't want to say painful to scare you, but it's not like a pap. It's definitely more uncomfortable. So what it feels like if you are having a bad period cramp. And because of reflexes, the more you feel that cramping, at least for me, I want to close my legs, and that is the worst thing you can do. Just try to keep as relaxed as possible. For me, I have this very, very lovely nurse who's always there with me, so she held my hand or try to hold my leg open a little bit, because it just feels like a very bad cramping, and you just you want to it to be done, so you keep going like this, kind of like jerking, as I did. And after that procedure, it's important to walk with a sanitary pad. Do not use tampons. Tampons are a definite no. So no tampons. You do have a little bit of bleeding, so take a pad, or your doctor's office may provide you with one. In my case, my doctor's office provided me with it. And of course, get yourself clean, you put on that pad, and you wait again for another couple of days to another week or so, depending on when the sample comes back. At this point, again, it is. Oh, I think I forgot to mention this to you. You are not allowed to have sexual intercourse for at least 3 days. But I'm not a doctor, so none of this is doctoral advice, none of this medical advice. None of this is medical advice. I'm not a doctor. This is just from my experience. So do check with your doctor before and after the procedures if you do need to get one. Now, at this point, and some people do also experience that kind of cramping and period pain for a few days. For me, I actually had some spotting for about 4 days. So I avoided sexual intercourse, for a little bit, maybe for about a week or so. And I did have that cramping for a little bit too. I think I had a cramping for about 2 to 4 days. Now, if I haven't said this already, I have been through 2 rounds of PAP and 2 rounds of biopsy, because my first set of PAP and biopsy came back abnormal and I had to do a LEEP. I did one LEEP already in November of last year. That would have been November 2020. And I have a next LEEP scheduled in about 2 to 3 days. I am not excited. I am filled with anxiety now about it. I kid you not. When my doctor called and he said, "Hey, your biopsy came back abnormal again. We need to do this LEEP," my heart sank. I could feel my heart palpitating. I could feel like I want to cry, because I hate the LEEP. And I know I should be thankful that it's not anything serious or more serious. I should be thankful because I don't know what other women's circumstances and situations are like. But honestly, I'm just tired. My body is exhausted because in 8 months I've had to push out a baby. I've had 2 LEEPs, well, about to be 2 LEEPs, 2 biopsies, 2 PAP. It comes a point in time where we are just exhausted and tired and just want to have a break. And with each of these procedures, they come their own side effects. And with each of these procedures, you're bleeding for a few days to maybe a week or two, and then you still have your regular period on top of all of that. So it really takes a toll on you mentally, emotionally, physically. So let me now talk about the LEEP. At this point, I need my laptop because we're about to get a bit technical. So after that waiting period, my biopsy came back and my doctor said, he called me, okay? I can't get that call out of my head. This is the second time. The first time I'm like, okay, cool, yeah, we need to do it. We need to do it. We gotta get it over with. It's necessary. The second time, of course, it's still necessary. But I remember he called me and he said, "Hey, the results came back from your biopsy. It's not great. We need to do another LEEP on you." And at that point, I was like, oh my God, because I felt my heart sank. I felt anxiety. I felt like if I wanted to cry, my heart was palpitating. And I just felt like something I was like, kind of, and I went to my husband, I'm like, they need to do it again. And at that point, I think you realize how frustrated I was, because with each of these procedures, it takes a toll on your body. And with each of these procedures, it also comes with its own downsides. You bleed for a couple of days, so maybe a week or two, especially with the LEEP, it has some side effects with that. And on top of all of that going on, you still have your regular period, and then you still gotta go about being a full-time mommy, being a full-time working mommy. It's hard. So, okay, so let's really get into LEEP now. So, if your biopsy came back with HSIL, high grade squamous intraepithelial lesions, then you likely are going to be doing that LEEP. So, the LEEP is called, I'm going to tell you what the LEEP is called. The LEEP is called the loop electrosurgical excision procedure. Now I'm looking at my computer because I don't want to get this name wrong. So basically, I'm gonna put my computer back. So basically what the LEEP is going to do is it is going to use some sort of heat to remove those bad those bad cells, or those abnormal cells. Now these are not cancer cells, they're pre-cancer cells, and if HSIL is left untreated, it could lead to cancer cells. With obviously, I don't know if it means for sure cancer or it could be cancer. So these are things that you need to address at the onset, at the very beginning, the very earliest point. And I'm glad that my doctor was so proactive about this. Um, you know, to address these things very early on. So let me tell you how the LEEP works. With the LEEP, again, you get undressed and they are gonna put it's not a device, but they're gonna put paste something onto your leg to prevent any sort of like shock from the machine. That's basically to ground you. So you're in the chair now, putting your legs up, of course, and again the vaginal speculum is used. So after you've had that device, pasted on you, you're gonna get up onto the gynecological chair. You're gonna put your legs up, of course, and this time, however, you need local anesthesia at this point. So they're gonna honestly, this needle, like, I have a picture. I'm gonna put it either here or here. I don't know if I could have taken this picture, but when I got in to to sit on everything, I'm like, holy crap, that is a big needle. I took a picture. I sent it to my husband. I'm like, oh my god, this is a big needle. I hope it doesn't have to go into me. It did. But they're gonna numb you. And of course, if you have any pain, they tell you just raise your hand if you're having any pain. I wouldn't advise you getting up and moving at all. Just raise your hand if you're having any pain. This procedure takes about 20 to 30 minutes. You don't have to go to a doctor's office. It's done right in your gynecological, wherever he or she is located in their office. There's no like recovery time in terms of like a hospital recovery time. There's no need to be admitted into the hospital. It's a procedure, not a surgery. So it's important to know it, so don't be feeling overwhelmed. So you get up there, you're numbed, you're grounded, and through a microscope now, and a light, the doctor's going to begin doing his thing. Now, you are going to hear noises, so I wouldn't, don't be too alarmed. It's going to sound like a kind of noise, like a humming, kind of singing noise, or slightly like a small drill kind of noise. And that's basically him or her, removing those precancer cells. I really hate this procedure because although I was numb, you don't feel pain, but you feel a lot of pressure, and I was like so tensing myself up. And of course, your doctor's gonna tell you, okay, you may be feeling pressure now, or okay, let me know if this is hurting. I think for me, I was somewhat still in pain, so I asked for a second dose of the anesthesia. And I think I was given that because I was just so uncomfortable. Now, after that 20 to 30 minutes, and you're gonna have more than one person, more than one doctor is there with you if you need to, nurses, or maybe if they need more than one doctors. But I had two nurses there with me, and my doctor, of course. So when he was done, he was like, okay, we're all done. So he left the room. I got dressed and everything. Now again, walk with a sanitary pad. If you don't have a pad, then ask your doctor's office, they're going to give one to you. They usually give you it in any case. You cannot insert anything. Do not use a tampon. Tampon will give you infections, and it's already scarred and bruised. It needs time to heal. You don't want anything aggravating it further. So you wipe, you get dressed, speak with your doctor, of course, address whatever concerns you have, and then that's it with the LEEP. Now, there are side effects that possibly could happen. Of course, there's pain in the area. For me, I had some slight pains, and about, I don't know, 10-15 minutes after the procedure, I began to feel so nauseous. I felt so weak and exhausted. Thankfully, I took an Uber home. My doctor's, is in the city by Central Park. And I took an Uber home, and I was probably like almost home or halfway home, and I texted my husband. I'm like, I'm really not feeling good at all. I wanted to pass out. I wanted to throw up. So what he did, I think this worked. He got some Pedialyte for me and popped it into the freezer so I get it when it's cold. And he gave me some crackers, some dry bland crackers, because I felt like if I ate anything, I was going to just throw it up. So I got home, and he gave me the Pedialyte and some crackers, and that helped. I couldn't even take a shower because I was just in so much pain and just feeling so nauseous, and the warm water, especially if you're feeling lightheaded, could make you pass out. So I just ate, and I had the Pedialyte, cold Pedialyte, definitely a recommendation of mine. And I just went and lay on my bed for a couple of minutes. I don't know if I can't remember if I fell asleep, but I just lay there. And within a couple of hours, I felt fine. I'm trying to recall if I was given medication or not. I don't think I was. I think I used just over-the-counter pain medication. I think I used Tylenol, and that helped. So that is the LEEP procedure. Oh, before I forget to tell you, there is no sexual intercourse for 3 weeks with the LEEP procedure. My doctor cauterized it, I think it was. I don't know if that's the correct terminology, but whatever he did, he put something there so it wasn't bleeding a whole lot. So I think it was 1 or 2 days of spotting, and that was it. But still no sexual intercourse, because you can make it more difficult for yourself and worse, because then you can have additional scarring. You can have infections, and it really just needs to rest. Your cervix needs to rest at this point, because you've just had something like a zapper scrape out those cells. So you just need it to rest. It's bruised right now. It's bruised on the inside. It needs to rest, just like your body. So that is the LEEP procedure in a nutshell. If you haven't already, please scroll over and subscribe to my video. Like it. I am going to link my other videos and my subscribe button either here or here or here and here. Please do like and subscribe. It really helps me to keep making these videos. As you know, I'm a small YouTuber. So I am going to see you in my next videos, guys. Bye.